Hi, I'm Angela Paxton, and I'm the practice coach and parent consultant for Chip In for Quality Indiana, Indiana's Child Health Improvement Partnership. Several of the primary care practices we work with have had success implementing daily huddles. Dr. Mary McAteer is here today to talk about her experience with huddles and how they got started.
Hi, I'm Mary McAteer. I'm a pediatrician in practice at Meridian Pediatrics. I wanted to tell you about our adventure with starting morning huddles, which we've been doing for about 6 months. It has really improved the flow and efficiency of our day.
Dr. McAteer, what is a huddle?
Typically, it's a 3 to 5 minute, very short meeting. It's held on our feet with the goal of making the day run more smoothly.
Why conduct huddles?
According to the Institute for Healthcare Improvement, the idea of using quick huddles as opposed to the standard 1-hour meeting arose from a need to speed up the work of improvement teams. Huddles enable teams to have frequent but short briefings so that they can stay informed, review work, make plans, and move ahead rapidly.
Dr. McAteer, how did you get started with huddles?
We started huddles with a small amount of work. We were interested in improving our communication between the different teams that surround our patients' care. Teams such as secretaries, nurses, and physicians.
I understand there are 3 types of huddles at your practice. Can you describe each one and who attends?
The first huddle, the office manager meets with the secretaries about 5 minutes before the secretaries are due to man their positions. They go over a little bit of howdy-do time and how everybody is doing, and then news of the day is shared, such as if a doctor is not going to be there, or if we're having a lunch provided by a drug rep, or a new process is going on with welcoming, or dealing with the patient's visit. And then the office manager moves to the nurse's station. She will fill the nurses in of the news of the day, and the nurses also have a chance to discuss with one another about new equipment or a new way to do things. The third huddle will involve my nurse and my secretary and myself, and we will look specifically at the schedule of the day and look for patients who may need a little bit extra time, or perhaps some additional information, such as a patient was known to have visited the ER the night before and has labs and information that should help me be more efficient during their visit.
What improvements or benefits have you noticed since implementing the huddles?
What I've noticed is that the communication between the 3 different teams has improved greatly. I have a better feel for what's going on, and I think our secretaries and our nurses also are much more on board with keeping me on time and keeping the patient's visit as pleasant as possible.
What barriers did you need to overcome?
I think the newness of the concept was a little difficult for everybody to get their heads around. It seems like such a simple idea, and yet it makes such a huge difference. And so just by doing it, I think we got a little bit better buy-in from everybody, because everybody it became routine after a while. Now everybody looks forward to that time, and I can see that it's even extended into smaller huddles throughout the day when the need arises.
What advice or tips could you share with other practices who want to start huddling?
I think the first is to determine that that's your goal, is to have a huddle. And then you need to settle on a time to meet consistently. You could experiment with different participants and see who needs to be at each different huddle. Definitely limit every huddle to 3 to 5 minutes only. Hold the huddle in a central location that makes sense so that you can be efficient. Also, inviting everybody to stand also helps you to be very efficient. Designating a huddle leader or someone who can come up with a way to conduct the agenda and perhaps have a communication focal point for different huddles to touch base with that person could be a really good idea too, to improve communication. So I invite you to try huddling. I think if you would like to improve communication and improve efficiency in your office, that is a great way to get things done. On 3. 1, 2, 3, go team.